Let's talk about pain following breast surgery. Whether it's for breast cancer, including a lumpectomy, a mastectomy, with or without tissue expander placement, an augmentation, a reduction, a reconstruction, and the list goes on, it's very common to get pain in the chest wall as well as the upper back following these surgeries. But you don't have to suffer. There are very basic stretches and exercises that can help you with mobility and pain reduction following these surgeries. Today I'm going to focus on a few basic exercises that you can get started with right away. As with all exercise programs, make sure to clear them with your own medical team, particularly if you have any spinal metastases, as there are some rotational components included with these exercise programs. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. So stay tuned for my phase 1 exercises in order to help you reduce pain, improve mobility, and feel better faster. The first video is going to be our phase 1 exercises. So these will be safe to do even if you have drains in, starting at about 3 to 4 days following surgery. And of course, diaphragm breathing, which is my number 1 exercise, is safe to do as soon as you can. Why do I talk about diaphragm breathing for post-surgical pain? Well, aside from all of the other benefits, such as relaxation, improved lymphatic flow, when diaphragm breathing is performed correctly, it does allow for some chest wall and rib mobility. And anything that is going to help move our rib cage is going to help loosen up the ribs as well as the spine and even the attachments on the breastbone where it's very common to have pain. Let's start with one hand on our chest and one hand on our belly. As we perform diaphragm breathing, it's the belly that's going to move outward and then inward, but it's actually the diaphragm muscle underneath the rib cage that is expanding and contracting. And this movement is what's going to allow a very gentle stretch of the rib cage. So as you breathe in, I want you to fill your abdomen or belly with air and feel your bottom hand move out away from your body. So breathe in and exhale. The tummy comes back in. Breathe in, fill the belly with air, and exhale. You will also feel some movement of the upper chest wall, which means our lungs are filling with air. But when you do this, I want you to feel the belly move more. Now, also, if you do this correctly, you may get a little bit lightheaded or dizzy. So only start with 2 or 3 of these. Any movement is going to be beneficial, and you can do this throughout the course of the day. Exercise number 2. We're going to start very basic. You're going to put your hands behind your head, and you're going to push your elbows out behind you. Now, in order to stabilize our low back to ensure that the mobility is coming not from here, but from up here, I like to put my leg on either side of the chair in order to stabilize my low back, as well as pull my belly button in and elbows back. Feel the stretch in the chest wall and try and pinch the shoulder blades together behind you. Forward, backwards, forward, backwards, sitting up really nice and tall. And then you can focus on one elbow going back, come forward, and the other elbow going back. Try and get just a little bit of rotation. And you can do 5 to 10 on either side. For the next exercise, I like to turn my chair around. So I'm going to sit with my chest wall facing the back of the chair. I'm putting one leg on either side of the chair to stabilize my low back, as well as pulling my belly button in. Sitting like this against a chair prevents you from bending forward too much with your arms crossed here, or again with your hands behind your head, whatever you feel more comfortable with. And you're just going to make small circles of the upper back, as if you are looking straight ahead at a clock being 12 o'clock, behind you being 6 o'clock, to your right would be 3, and to your left would be 9. You're going to simply go from 3, 6, 9, center. We don't need to go forward to that 12 o'clock again. We just need to follow the clock gently. 3, 6, 9. Now this is a small movement, but you can see I'm getting the mobility in my mid and upper back and not so much in my low back. And then reverse the circles. 9, 6, 3, forward. 9, 6, 3, forward. Make sure to keep that belly button pulled in so you're not arching the back too much. 5 to 10 circles in each direction would be perfect. And again, make sure that you're not doing anything to increase your pain. You want to go in your pain-free range of motion. We're just trying to promote mobility and movement of the chest wall and upper spine. Another stretch that I absolutely love following breast surgery is a corner pectoral stretch. Now this stretch can also be either a phase 1 or a phase 2 exercise, depending on how you're feeling and based on the recommendation of your personal medical team. First, you need to find an empty corner where you can easily position yourself and move your arms. You're going to face the corner, one foot in front of the other, and it doesn't matter which foot goes forward, but the point of this is to stabilize, again, our low back, and you're also going to pull your belly button in to ensure that you're not getting a lot of low back mobility, but the stretch is coming from the upper chest wall. So we're going to place one foot in the corner, one foot behind. Your forearms should go flat against either side of the wall, okay? Making sure that the elbows are not lifting up, but everything is flat. You're going to hold for about a count of 10. Now, if you need to change your position to move closer to the wall or further away, you want to go where you feel the stretch and yet it's still comfortable. There should never be sharp shooting pain with a stretch. You should feel like you're really trying to open up this chest wall. So you start with your elbows down, forearms are flat against the walls, and you're going to hold for about 10 seconds looking straight ahead. After 10 seconds, you're going to curl your fingers up a little bit. Keep the forearms flat against the wall and lean forward again. Hold another 10 seconds and then move up one more time, making sure the shoulders stay down. We never want to wear our shoulders as earrings, right? As you perform this stretch, every time you raise the arms up the wall, you're changing the angle of the pectoral muscles that you're stretching, so the stretch will change. Remember, the point is to stay in your pain-free range. This exercise can be performed 2 or 3 times in a row, a few times throughout the day, depending on how you're feeling and what your needs are. The last exercise for phase 1, which could even move to phase 2 if you need to, is laying on a towel roll. So I have here a hand towel that I've rolled up just about 2 inches thick. Now a towel is going to have a lot more give and be a lot less intense than a foam roll or even a half foam roll. So I do not suggest using a foam roll, especially if you're very early on after surgery. A foam roll does require specific clearance from your own medical team in order to perform. But you can take a hand towel, you can take a full towel, and you can roll it up as thin or as thick as you like. Especially as you get started, I would start on the thinner side. So you're going to put the towel roll down on the surface. I suggest a firm mattress or the floor, as a soft mattress might have too much give and you won't feel any stretch in the upper back or spine. Put the towel roll down and safely turn onto your back by first going down onto your side, legs up. I'm going to scoot down so I stay in the picture here, turn onto my back, find the area along the spine where there's the most pain, and simply lay down flat on the towel roll. You can keep your hands at your side. I'm just raising my arms up so you can see the gentle arch in my back based on the towel roll. You can lay here for 30 seconds, a minute, up to 5 minutes to reduce your pain and aches. And you can always move up and down on the towel roll to different levels of the spine, depending on how you're feeling. So moving it up just a bit. And again, if this is too aggressive early on, you can save this for phase 2. Thank you for joining me for these phase 1 and phase 2 exercise routines for pain in your upper chest wall and upper back following any breast surgery. Please remember to discuss all of these exercises with your own medical team to make appropriate adjustments as necessary. I hope they have you feeling better with improved mobility real soon.